Hello, everybody. This is Erica Ives, CEO at Mindfulpath. Hope you are all safe, well, and healthy. Today, I am here to talk to you about addiction and eating disorders during this COVID-19 pandemic. And I want to say that I know how difficult this time can be when you are struggling with addiction or an eating disorder, or you are early in recovery, or sometimes even later in recovery. Uh, Times like this of incredible overwhelm, incredible unpredictability can and all this time we have on our hands, let's not forget that, can all be really, really, really immense triggers. And those of you who've been through it, going through it, know exactly what I'm talking about. And I know that your addiction and your eating disorder may not only be knocking at your door, but there is a high probability that it is actually banging on your door. And this, more than ever, is a time where you got to keep your doors locked. You cannot open that door when it's screaming to you and telling you everything you need when it's really not what you need. It may just be what you want. And you know rationally it's not the right time. It's not the time at all, but you are at high risk potential relapse right now. And we can't let that happen. None of us can let that happen. While, of course, this COVID-19 is affecting our physical health, so many of us have known people going through this, have lost people going through this. And what about our mental health? Let's not forget about our mental health. And I know it's being talked about. And I am so happy to see so many people rising to the occasion, rising to this moment. But I'm going to tell you, it's not enough, because people are not thinking about, like really thinking about, and this is not a generalization of everybody, but a large majority of people are not thinking about the global mental health crisis that is going to follow this epidemic when the country reopens and we're back out there. We are going to be faced with so many different struggles, and that terrifies me. And you want to know what? If you've been through it, it should kind of terrify you too. The thing is that we do have some power and we do have some control when it comes to this, and we must all spread the message to help each other. Like I said, addiction, eating disorders, self-destructive behaviors, banging, banging, banging on your doors, shaking your windows, doing anything it can to get inside your mind, get inside your heart, get inside your body. But now more than ever, you got to grab hold of those tools in your coping skills toolbox and keep using them. When one doesn't work, try another one. You know, I'll share something with you. When I very first got sober, I I I just didn't know how to get through a minute at a time, like literally. And I can tell you, one of the things that I did was I bought a timer, and I literally would turn the timer on for minutes at a time and sit there or try and do something, anything, and be like, okay, I just got to get through these few minutes, just got to get through these few minutes. And then as time goes by, the more time you get through, I promise you, it does get easier, because with anything you practice, including recovery, and you're doing the work, like really doing the work, I am telling you, it gets easier. You have to be patient. I know it can be frustrating, but there are so many magnificent tools and people out there who are going through the same exact thing, and we all need each other. And we at Mindful Path are trying to, broaden our services. We now are offering online classes, including like breath work classes several times a week, yoga and meditation packages we're putting together. We're doing food and feelings donation-based group. We're doing groups for those on the front line, those magnificent, courageous, brave, unbelievable human beings. Like, we're offering them donation-based support. We're offering COVID-19 coping skills classes, and we're going to add more. And we are going to do our best to rise to the occasion so that we can be there for you. But this is also about prevention for what lies ahead. So I know I'm speaking maybe loud, but I'm so passionate about this because I'm literally terrified. It's keeping me up at night at times, thinking you're hearing my dog. Sorry about that. He's responding to my emotional state right now. But it's keeping me up at times because I'm scared. I'm scared that we don't have a good enough strong enough plan in place. And I'm going to keep doing my part, and my team is going to keep doing their part. And all my colleagues I talk to, I know they're doing their part, and we will keep being here to serve you. But there are coping skills. I mean, even for eating disorders, I had no idea. There's a food and feelings group on IGTV, on Instagram, that literally is happening every single hour, and it's free. And you can actually have other people who are eating a meal together. And it's led by a dietitian, it's led by a therapist. So, there's a lot of free options, and I'm working on putting those onto our website as well, which you can take a look at, mindfulpath.com. And I just want to tell you that you are truly not alone. You are so not alone. We all need each other. We've been saying this. All of us have been saying this, and I think we know it. This is not the time to go inward, even though you may feel so alone. This is the time to reach out. And if someone's not listening, yell and scream and find the right people who will listen, okay? Because you deserve it. You deserve it. You deserve it. And you can come out on the other end stronger instead of weaker and sicker. But we are here. And if we cannot provide you a service, we will help you find something that works for you. So I ask, please participate in this movement, this preventative movement on staying on top of our mental health, because of what's about to follow with our mental health after this pandemic. Because those who have struggled with mental health issues, we may see a real reuptake, and those who haven't, well, that may happen too. And people aren't prepared for it. They don't know what to expect. So I'm going to do a video, my next video, on what to expect with your mental health. But please, please, please come back. Listen, I want your feedback. If you have a good resource you want us to put on our website, shoot me an email. Let me know. I'll get back to you. We'll add it on our website any way we can help. I wish you all the best. I wish you strength. I wish you peace. I wish you hope. I wish you tools to self-soothe, tolerate your discomfort, walk through the difficult emotional states you might go through. You guys have heard me say, don't walk around it, don't walk over it, don't walk under it, because then it's still there and it builds up. Walk through it, okay? And we're here, we are here, and we all need to remember that last video I talked about virtual hugs. We need each other. We need to reach out even when we may feel so isolated, so isolated. But I am wishing you all a good Friday. I am wishing you all a happy Passover. I am wishing you all a happy Easter. Find strength. Surround yourself with people who are safe, who can love and support you, and vice versa, and we will get through this. And with that, again, please stay well, please stay safe, and take care, and we will be back soon. All right. Take care. Bye-bye.